Tonight, university health experts are urging students to stop vaping while the Centers for Disease Control and Prevention investigate a series of illness outbreaks. According to the North Carolina Department of Health and Human Services, 28 cases of the illness tied to vaping have been reported in the state.
Really alarm all of us.
Coordinator of Student Wellness Programs, Kelly is a certified substance abuse prevention consultant. Her advice to students:
listen to the CDC's warning. You know, this is not about creating hysteria, but this is serious.
According to the CDC, there are 380 confirmed cases of lung illness in the U.S., and 6 people have died. Kelly thinks the issue of vaping has been dismissed, and the CDC's warning is an awakening to take a closer look at vaping devices.
Risk associated with using the product.
The risk both short-term and long-term.
Increasing your heart rate, your blood pressure, your metabolic rate, and so those are all, health risks that in the long term could lead to, cardiovascular and respiratory disorder.
ELN senior Will Henderson started juuling his freshman year at ELN.
Everyone else was doing it at like Darties and stuff, so I just felt like I needed to also.
Henderson says after going through 6 Juuls, he recently decided to quit.
I'm nervous about what I've done in the past, but I'm glad I stopped now.
ELN sophomore Sam Moreland says she first used a Juul nearly 3 years ago, after trying a friend's, then buying her own.
Really, I wouldn't keep doing it if I wasn't addicted, honestly.
Moreland says she goes through 1 Juul pod a day, which, according to Juul, has the same amount of nicotine as 20 cigarettes. She says her family has tried to get her to quit, but it hasn't worked yet.
It's harder than it sounds. I've tried to put it down. I really have.
Kelly, in collaboration with Sparks, launched a Juul exchange program where students can turn in their vaping device in exchange for complimentary fitness trainings and massages and resources to help them quit. For help quitting, you can stop by the Sparks office in Mosley to get a quit kit or visit quitlinenc.com.
And President Trump and his administration are planning policies that would ban the sale of most flavored e-cigarettes. We took to the streets of campus asking students what they thought of the administration's plan.
I think that people have a right to use them. However, I think there need to be more restrictions on them because certain populations, will say, and certain demographics shouldn't be using them. But subjectively and objectively, I don't think they're necessarily that healthy for you. So I think it's going in the right direction, but I don't think we should ban them in total.
I think that they were initially made for people that do actually smoke and for them to kind of lean off of that a little bit, and now it's gotten into the hands of a population that likes to spread very fast those kinds of influences.
They were first put in place as kind of an alternative, and now, clearly they're not. For a while it seemed like they were working, and now there's drawbacks to it, but I think at the end of the day, anything they put in place, there's going to be consequences.